Hey guys, welcome back to the myPAbox YouTube channel. My name is Samantha and I am an affiliate of myPAbox. So most schools require at least 1,000 hours of patient care experience or healthcare experience in order to apply to their program. Not only do you need those hours, but you also need to keep track of specific details associated with your experiences. And so in this video, I'm going to show you guys how to keep track of not only how many hours you have, but also all of the specific details that you're going to need when you actually apply to CASPA, because there are a lot of them, and a lot of them actually caught me by surprise when I applied. But fortunately, if you guys have myPAbox, they make it super easy to keep track of all of the little details that you'll need when you actually input it into CASPA. So let's get started, shall we? So this is the home page of myPAbox right here. And if you look on the bottom, there's like a dark blue/purple bar, and it has 4 different tabs associated with it. So if you go to the dashboard, which is the farthest one to the right, then you can see these 6 different sections. Of course, we're going to be talking about healthcare hours today, so I'm going to go ahead and click that. As you can see, I haven't input any of my experiences into myPAbox yet because I want to do it with you guys. So I'm going to go through just like a sample scenario of what it would look like if you were to input your healthcare experience into myPAbox, so you guys can really get a sense of what this looks like on the site. I'm going to hit add experience. And so already, as you can see, there's a lot of information that's associated with adding one healthcare experience into myPAbox. Guess what? When you apply to CASPA, it's going to be the exact same way. You're going to need to import all of the information that's listed here into CASPA when you apply. And unfortunately, when I was going through my experiences, particularly in the beginning of my working as a CNA, for whatever reason, I didn't document all of these specific details. And so there were quite a few different places that I worked as a CNA, and I needed to go back into the archives and dig those out when I was applying to CASPA. Fortunately, myPAbox really helps streamline this entire process. So we're gonna go through it. We'll go ahead and click experience type. In experience type, you have community service, you have direct paid patient care hours, you have direct patient care hours, indirect patient hours, and volunteer hours. So I'm gonna go with direct paid patient care hours, and hypothetically, I'll just put my organization name as Samantha's Clinic, why not? And my address is, we'll just say No Man's Land. City, I'm in Buffalo right now, so I'll just say Buffalo. And New York, zip code, I don't know if this zip code exists, but I'm just gonna say 14110. And then hit next. This start date and end date is very similar to how CASPA has the hours formatted. I'll say that I've worked for them for a year. So let me go back to July, and I'll say July 1st until July 1st of this year. You wouldn't have to specify a specific start date if you said you were employed only part-time. So we'll leave it at part-time and see what happens. So you hit next, and then this is where you enter your supervisor information. Many people, myself included, did not realize that I would have to enter my supervisor information. I was working as a CNA 5 years before I applied to PA school. And so that's not information that I had readily available and did not have the foresight to realize I would need for whatever reason. It seems common sense now, but to be honest, I just didn't think about it at the time. If I had had myPAbox, it would have been obvious because myPAbox really tries to emulate the CASPA system, so you won't have as much friction when you do apply to PA school. We'll add the supervisor information. I'll just put my name and title, the boss, phone number, we'll just do zeros, and email, we'll just do contact@email.com. So as you can see in the direct paid patient care, it says I have 0 hours. We are gonna fix that. So we're gonna click that, and we're gonna go log hours, single date. So say I worked today and I worked 8 hours. Then I could add hours, and then it would show that I have 8 hours total. And this is super motivational. You know, say you work 25 hours in a week. Then you can say, okay, log hours, date range, say my start date, last week, Monday, it started, and then it ended last week, Friday. Let's say I worked a total of 40 hours that week. Then I can do add hours, and then it says 48 hours total. So you have a running total, and this keeps you motivated to keep pushing for more patient care hours. And of course, you can add any additional experience. So say you have volunteer experience at X place, then you have that volunteer experience as well. And you can say, okay, I volunteered there for 3 hours today. So you go back and you can see on your healthcare experience summary list that you have 3 hours for that individual experience, and you have 48 hours for Samantha's clinic. You can break up all of your individual experiences on this list, which is really helpful and it's motivational. So you can say, okay, what should I focus on this month? Where am I limited in my hours? And I could say, I have only 3 hours volunteer experience. I should probably devote a little bit more time this month to giving back to my community. And it helps you evolve to be a more strong applicant because you're constantly working on improving weak areas in your application. One other thing I want to mention about this page is that if you click one of your experience locations, like for example, I click Samantha's clinic, and then I can look on the top right, it'll show me the contact information of that clinic. So if I needed to call them to ask them for a letter of recommendation or something of that nature, then that information just stays in myPAbox's system so you can easily access it. The last thing that I want to mention about the healthcare experience tab is that there's an area for certifications, because in CASPA you'll have the opportunity to import your certifications directly onto the CASPA site. This is really nice because you can keep track of all of your certifications as you go through the pre-PA process. So I'm going to hit add certification here, and then the certification type, there's 3 types. So there's BLS, CPR, and ACLS. So I'll just say I have my CPR certification and I completed it. We'll say I completed it on Monday. We'll just say arbitrarily that it expires next year on the 19th. And then you can save it. You can see that you have the CPR certification, and then you can edit it from there if the expiration date was incorrect or anything of that nature. It's nice that you can keep track of all of your certifications, your hours in a very streamlined process on myPAbox. So that is a walkthrough of the healthcare hours feature on myPAbox. I hope it was helpful. I hope it was inspiring for you guys, and you guys are ready to clock in all of your healthcare hours directly onto myPAbox and see how many hours you have and start accumulating them as you keep going forward in your PA journey. So if you guys don't have a subscription to myPAbox yet, but it's something that you're interested in, you can use my code Samantha15, it's all capital letters, for 15% off. If you have any questions whatsoever, feel free to reach out to myPAbox on Instagram, or you can even reach out to me and I'm happy to answer your question, whether it be myPAbox related or otherwise. So aside from that, thank you guys so much for watching, and I will see you in the next video.